All right, I'm already seeing people from all over the state of Minnesota and South Dakota and Missouri. So welcome, everyone. And with that, I'm excited to turn it over to our moderator, Dr. Martha Nance.
Well, thank you so much, Erin, and thank you to everyone who has registered, and Tucson, Arizona is checking in. You know, there have been a lot of bad things about COVID, but I think one of the best things that's happened is people becoming more familiar with how to do these Zoom meetings. We lose a little bit by not being in person and seeing each other together and shaking hands and so on. On the other hand, it really empowers people to come to this conference from all over the state, all over the region, and as you can see from the map, all over the country. So welcome everybody. Thanks for coming, and hope you enjoy the morning. So the schedule for today, there will be three main sessions, one on sleep, one on cognitive changes, and probably the most exciting thing for me, I think, is a presentation about how to be optimistic, how to be joyful in the face of Parkinson's. In between each session, we'll have a little bit of a break. At 10 o'clock, we'll have a live break with our physical therapist, Laura Des Hotels, leading people in a little bit of Tai Chi. And then we get another break at 11. Each of these breaks is going to be 10 or 15 minutes. So hopefully we'll have a wonderful morning talking about things that aren't motor symptoms of Parkinson's. So I'd like to thank our partner, the Parkinson Foundation. The Struthers Parkinson Center has been a Parkinson Foundation Center of Excellence for many years. And we've always enjoyed a wonderful relationship, and it's kind of fun to work together on this particular conference. I'd also like to thank our sponsors. We can't do this without sponsors. Today's sponsors are Amneal and Kyowa Kirin. So thank you to them for helping us bring this to you. Just a little bit about Struthers Parkinson Center. So Struthers Parkinson Center has been in Golden Valley since 1995. And about 3 or 4 years ago, we added a second site on the location of the Neuroscience Center, the Health Partners Neuroscience Center in St. Paul. Gorgeous building, beautiful space, and wonderful team in what we now call Struthers East. People with Parkinson's can be seen in either location. The hallmark of what we do is we have not only doctors and nurses, but on-site rehab therapy, social work. We do deep brain stimulation surgery. We do clinical research. We have educational classes and programs and support groups and so on. So really a full service center for people with Parkinson's and their families. So on to the theme of today's conference, addressing the bottom of the iceberg. Perhaps even the major symptoms of Parkinson's are the ones that aren't the motor symptoms. So today we've selected 3 topics. The first one is coping with challenges related to sleep. Please, as you hear these presentations, all 3 of our presenters have pre-recorded their talks, but there will be just a few minutes at the end to ask questions. If you can type your questions into the chat room, then I can handle some of these questions at the end of the presentations. There won't be time during the presentations to have real-time answers. It'll be at the end of the 3 presentations. So we asked 3 folks to help us address sleep. Dr. Elliot Johnson is one of our neurologists on the Struthers West side. He will talk from the physician perspective, what kinds of treatments do we use and alternatives do we have. Lori McManus is an occupational therapist at the Struthers West, who will talk about how to sort of optimize sleep from a non-medical perspective and how to promote wellness. And then Lacey Severson, who's one of our social workers, who does some counseling. We'll talk about cognitive and behavioral strategies, things that we call sleep hygiene, and also relaxation techniques to help people sleep. I see a question already. Should you type your question into the Q&A or the chat box? Either one works, as Danielle has noted. So without further ado, let's just get started on our first set of presentations. Thank you, Aaron.
Hi, I'm Elliot Johnson. I'm one of the neurologists at Struthers. I'm going to be the first speaker as part of a three-part series on strategies for coping with sleep challenges. I figured the best way to start this out would be to talk about different types of challenges that can happen during sleep. So talk about some different disorders that someone with Parkinson's can have, or just sort of issues that can occur overnight. I think, as I hope I am able to explain, the first step should be really figuring out what's going on. As you'll notice, some of the treatments for certain conditions can actually worsen other conditions, and there are good treatments out there. But the first thing you want to do is know what you're dealing with so you can arrive at the right treatment. All right, so the outline is basically we're going to characterize these different types of issues that can occur overnight, and then we'll talk a little bit about treatments as well. I don't want to focus too much on the treatment aspect. The really big picture will be just knowing that these different things can happen and trying to determine best what's going on. All right, so what happens, what kind of stuff happens at night to people with Parkinson's? First thing is insomnia. That's difficulty falling or staying asleep. The other speakers will talk about that a little bit more. Second thing I want to talk about is restless leg syndrome. That is a often hard to describe sensation that can occur usually in the legs, although also the arms. When lying down, sitting, usually happens when you're trying to go to sleep, can contribute to insomnia. Can happen in people without Parkinson's too, but can also happen in people with Parkinson's. Third thing I want to talk about is REM behavior disorder. This is a disorder in which you act out your dreams while you're sleeping, and this can happen in Parkinson's and be a part of Parkinson's. The next thing I want to talk about is vivid dreams. So vivid dreams are dreams that seem more real or are better remembered, but you're not acting them out. So different from the REM behavior disorder. Another thing I want to talk about are hallucinations. And hallucinations, in contrast, those last two things I talked about are things that happen while you're awake, not while you're asleep. But sometimes it can be tricky to know, are you having a hallucination, vivid dream, acting out dreams. Hallucinations tend to occur in more advanced Parkinson's. And the last thing is confusion. So confusion can sometimes be hard to distinguish from these other things. So some individuals who develop more memory troubles can tend to get confused a little bit more at night. All right, so the first thing we're talking about is insomnia. I'm not going to talk too much about this because the other speakers will talk more. The first two treatments I have listed there, sleep hygiene techniques and CBT for insomnia, will be talked about more, and I strongly recommend them. As far as medication goes, sometimes with Parkinson's, we'll try an overnight dose of the levodopa. That can help. It's sort of hit or miss how much it helps, but sometimes, maybe the medication is wearing off overnight while you're sleeping and you get stiffer or just get more uncomfortable or restless when that happens. So sometimes we'll try a little bit of levodopa. The main standby medications, though, for insomnia, in my opinion, are trazodone and mirtazapine. These are old antidepressant medications that can make you sleepy as a side effect, which can be quite helpful. There are a lot of things out there that, in my opinion, aren't too great to use for sleep. They can cause confusion, or you just sort of get tolerant to them and they stop working. So I've listed some there that aren't the greatest idea. Tylenol PM, which basically has Benadryl in it, Benadryl itself, Ambien, benzodiazepines, things like Valium, are things I wouldn't really recommend for insomnia. All right, so restless leg syndrome, we also wanted to talk about. This, like I said, is this hard to characterize uncomfortable feeling in the legs that gets better when you move around. That's really the way to diagnosis, do you have some feel in the legs that gets better when you move around, is a pretty good way to sort of suggest that this is what's going on. Really tends to occur later in the day, especially when you're trying to go to sleep at night, can really contribute to insomnia. The medication I like to use for this is called gabapentin. It's an old seizure medication. But I bring it up here in the setting of Parkinson's for a couple of reasons. One is that dopamine treatments can improve the symptoms as well. So just keep in mind that the levodopa you're taking could be helping treating the symptom, and if it's wearing off, it could be contributing to the restless legs. And also keep in mind that most antidepressants unfortunately make this worse. So that trazodone, that mirtazapine that we often prescribe for insomnia could unfortunately make the restless legs worse. So that can be tricky to manage. So next thing I wanted to talk about was REM behavior disorder. RBD is the acronym that is often given to this. So this is basically a disorder where you act out your dreams, and it is a part of Parkinson's, and some people can actually develop it before they develop the symptoms of Parkinson's as well. So REM sleep, REM sleep, is called rapid eye movement sleep. And this is basically a stage in sleep in which your full body is paralyzed, but your eyes are moving all over the place. And that's when you're dreaming normally. And normally when you dream, you're paralyzed. So if you're fighting somebody, you're running or jumping, you don't do that, which can be dangerous. But with this REM behavior disorder, you're often not fully paralyzed. So you can punch, kick, jump out of bed, yell, things like that. And sometimes it's more of a nuisance, but in some instances, it can be dangerous. And you could be injured or injured somewhere else. So in that case, we want to treat it. The first line treatment is melatonin. This is an over-the-counter medication that's pretty well tolerated. Can also help with sleep, with insomnia. I probably should have mentioned it in the insomnia page. If that doesn't work, though, we use stronger treatments, and that's those benzodiazepine medications. Clonazepam is usually one I go with. These are things like Valium. They can cause issues with balance or confusion sometimes too, so we want to be careful with it. But there are definitely instances where this can be dangerous, and we do want to use the treatment. Another thing to keep in mind is that antidepressants can make this REM behavior disorder worse. So, those insomnia treatments we talked about, the trazodone, the mirtazapine, could bring this out a little bit more. So we got to keep that in mind. Probably levodopa can contribute a little bit too, but usually we aren't changing that around a lot because usually the levodopa is more helpful overall than it's hurting. All right, so I want to distinguish REM behavior disorder from vivid dreams. So a vivid dream would be a dream that's just seems more real or is better remembered. But you're not acting it out, right? You're not moving, jumping, things like that. I don't know of a lot of great treatments for these. We often try melatonin. Luckily, they don't tend to bother people quite as much as some of these other things here. But the real thing to keep in mind is that donepezil, a memory medication we often prescribe in Parkinson's, can make these worse. So if you are on that, you can try moving the dose in the morning, and that can often be pretty helpful. So something to keep in mind, and also just sort of keep in mind, distinguishing a vivid dream from acting out of a dream. All right, so the next thing I want to talk about is hallucinations. And hallucinations, in contrast to these last two things I talked about, occur while you're awake. So hallucination would be you're seeing something that's not there, but you're awake during it, in contrast to like a vivid dream or REM behavior disorder, which occur while you're sleeping. Hallucinations tend to occur in more advanced Parkinson's disease, especially when the memory has been more affected. And like I said, they occur while you're awake. However, hallucinations are going to tend to be more likely in the evening, overnight, when things are darker, maybe you're more tired as well. So sometimes it can be confusing distinguishing hallucination, vivid dream, acting out of the dream. So the treatments I usually recommend for hallucinations, that memory medication, donepezil, can be helpful at times. There are a lot of medications that can make hallucinations worse, so we want to take a good look at the list. Some of the bladder medications can do this, and also some of the Parkinson medications can do this too. So we want to see, do we want to reduce or eliminate some things? And then there are some specific medications for hallucinations themselves that we can also use too. listed there, quetiapine, which can also help with sleep, as well as pimavanserin and a stronger one called clozapine. So there are some medications for hallucinations out there too. Last thing I want to talk about is confusion. So confusion is something that can happen in someone who's developed more memory problems. And this also tends to be worse in the evening and overnight as well. So sometimes it can be really tricky to distinguish, what's going on. Similar treatments to what we use for hallucinations. So we try the memory medication, and then also we'll try to decrease some of these medications, which can also make the confusion worse. However, I wouldn't recommend some of those other medications like the quetiapine, pimavanserin, clozapine for confusion alone. I would just use those for hallucinations. All right, so a summary. So what can happen at night with Parkinson's? So you can have insomnia, difficulty falling or staying asleep. You can have restless leg syndrome. Anyone can get this, but people with Parkinson's do too, where you just get this strange sensation in the legs. They can be uncomfortable, have to move around. Definitely can contribute to insomnia. But keep in mind that some of those antidepressants that help with insomnia can worsen the restless legs. You can also get REM behavior disorder, where you act out your dreams, and you want to distinguish that from vivid dreams that are just dreams that seem more real, but you're not necessarily moving around during them. Patients with Parkinson's, more advanced Parkinson's, can have hallucinations. These are something that happens while you're awake, though. So distinguish that from things that happen while you're asleep, like the REM behavior disorder and vivid dreams. Although it can be tricky because they often come more at night. And then confusion is something also that can happen more at night. You're not really seeing things that aren't there, but some people with memory problems can get a little more confused sometimes in the evening when things are dark, when they're more tired. This is a really a lot of information here. I don't expect you to remember it all, but I just really want to sort of emphasize the point that some treatments can help with some things, but also worsen other things. So really that's the reason to try to distinguish these different disorders before you talk about treatment, because they, medications for some things can worsen other things. So the first one I want to talk about is donepezil, that memory medication, also called Aricept, can help with confusion, can help with hallucinations, but unfortunately can contribute to vivid dreams. If that happens, moving the dose in the morning can be helpful. Levodopa, Sinemet, the main Parkinson medication, that can help with insomnia in some people, can help with the restless legs for some people, but it can sometimes worsen hallucinations and vivid dreams. Trazodone and mirtazapine, those are those antidepressants that I often use for insomnia. They can be quite helpful. However, they could, in some people, worsen restless legs and the REM behavior disorder. The benzodiazepines, those are things like Valium, clonazepam, lorazepam. Those can be helpful for the REM behavior disorder, but as we discussed, they can sometimes lead to confusion. And dopamine agonists, similar to the levodopa, they're a Parkinson treatment that is also used for restless legs, but they can definitely worsen confusion and hallucinations. And these dopamine agonists are actually, they tend to be worse for things like confusion than things like levodopa. So hopefully this was helpful. And the first step should really be determining what's going on before you start treatment. And the good thing is that there are a lot of different treatments for these different disorders. So often there are ways that we can help you, but we want to make sure that you're not taking something that's making something else worse. Take care.
Good morning, everyone. My name is Lori McManus, and I'm an occupational therapist at Struthers Parkinson Center. The goal of today's topic is to provide some practical strategies so you all can get better sleep. Restful and adequate sleep provide the foundation for daily life activities. We know that if sleep is disrupted for the person with Parkinson's disease and their caregiver or spouse, It can affect many different areas, including fatigue, cognition and attention, movement, mood, and just overall daytime function. Sleep and rest are part of our daily activities. And as occupational therapists, we often address everyday life, including nighttime. This is a model that we're going to use today just to address 3 key areas. So this shows the person, the environment, and occupation, which is really our daily activities and routines, and how they all intersect and affect each other. So we're going to look at each of these areas in more detail. We'll start with the person with Parkinson's disease. First, it's important to share your concerns. Often, it's a family member or a spouse or caregiver that start to recognize challenges with sleeping at night, particularly moving at night. So make sure you tell somebody on your healthcare team. Next, make sure you address other sleep conditions, such as pain, nighttime urination, and safety. And then lastly, check in with your neurologist regarding medications and what might be adjusted to be helpful for you. Recently, I was working with a gentleman who was having increasing difficulty at night with movement, and his wife was needing to get up more with him. He struggled to get back into bed and to get back to sleep. So they both checked with their neurologist regarding medicines, and they were able to adjust it. And along with some of the strategies that they included, it was very helpful. So make sure you check in with all of your team. Often, changes in movement due to Parkinson's disease symptoms, which can include rigidity, slowness of movement, and smallness of movement, can really make getting in and out of bed tougher. This can lead to difficulty falling and staying asleep, which is our goal today. How do we get better sleep and stay asleep? If you think about it, getting into bed, moving around in bed is a very automatic activity, just like getting in and out of a chair, writing, etc. So sometimes that change in automaticity can affect how we get into bed to get comfortable so we can sleep. This is an example of some strategies that we might practice during a session. So sometimes the use of a bed rail can be helpful. It adds a touch point for you to get in and out, and it also can help with rolling in bed. Sometimes a smooth sheet or a partial sheet can help with sliding and getting positioned where you want to. And then the other things we often teach people during sessions are ways to move and ways to roll. These are movements that you learn as a toddler. And so sometimes teaching a different, more specific technique can really make a difference. We often incorporate the use of bigger movements and then different ways to roll. And also it can, once you're taught these new methods, it can be helpful to practice them during the day so they become more natural at night. Sometimes it can be helpful to add some background noise or some white noise to help you fall asleep. Here's some examples of ones that I like. So the one on the top left is called Rain, Rain, and the bottom left is called Calm. I think a lot of you are familiar with the Calm app. But these are nice options if you feel like you can fall asleep better or get back to sleep with a little bit of noise in the background. The nice thing about these apps is you can set them on a timer. So let's say you set it for 30 minutes and then it'll fade out so it doesn't run all night long. And these apps have a variety of sounds on them. You can get waves crashing on the ocean. There's meditation, specific ideas. There's sleep stories. There's all sorts of things to choose from. So sometimes it might help just to try a different strategy to see if that helps you fall and stay asleep. On the right side of the screen is an example of a sleep tracker. So there's many apps to track our sleep. Sometimes it can be helpful to get an idea of what's going on at night. So it could give you more insight into your sleep-wake cycle. And these, you can find an app, or those of you that use iPhones, you can find it in the health section of your app. So it's the same section where you might be counting your steps. These are examples of lower tech white noise. So who can be just a regular old fan for a little bit of noise? And then sometimes air filtration systems have a little bit of a hum or noise to it as well. So the idea is to explore some other options that might help you get to sleep. Now we're going to turn to your environment. So it's one of those other bubbles on that first model. So here are some questions that you might ask yourself. What are some factors that affect your sleep habits? Is the bedroom and bed accessible? Make sure you've got enough room to get to your bed and move through your bedroom safely, especially if you're using a walker or a cane. So you want to make sure that path is open for you. The other thing with the bed is to make sure that the bed is the right height for you. So if you're having to jump up to get into bed, that can make it more of a struggle for you to get in bed and then get comfortable. A lot of our beds these days are pretty high because of thicker mattresses and box springs. So sometimes lowering the height of the bed can be useful. Ideally, you want the bottoms of your feet to touch the floor, not just your tippy toes. And then the last question to ask yourself is, are there safety concerns that may make it more challenging for you to get to bed? So sharp edges, cords, or other tripping hazards. Again, making sure you've got a nice path to your bed. This slide shows some examples of what we might try during a session to make sure it's the right strategy or the right fit for you. Everyone is a little bit different, so I think it's helpful to be able to practice some different ideas before you do it. Sometimes a twin bed can be a little easier to move in versus a big queen or a king size bed. It just gives you more boundary and definition of those boundaries. A recliner chair or even a lift chair might be comfortable to sleep in, particularly during the day if you're taking some naps. And short naps are okay because those are times of rest that can refresh yourself. I think the thing to remember is to try to take short naps and try to avoid those naps close to bedtime. Make sure the light in your bedroom is dim or dark. So looking at your curtains, maybe considering blackout curtains could be useful. But it helps with that melatonin level to help you fall asleep. And make sure the temperature is the right temperature for you. Ideally, if it's too hot, it might be hard for you to get to sleep. Smooth sheets and smooth pajamas can be helpful to reduce the friction when you're getting into bed and moving around in bed. The key here is doing these different things so that you get comfortable so you can fall asleep. So there's different types of smooth sheets. There's so many different types of sheets these days. There's bamboo, microfiber, but you might consider a better quality sheet so that it feels comfortable and you can move around in them better. You can also look at pajamas and what you're wearing to bed. So cotton knit and flannel can often be sticky. You want to avoid loose nightgowns or loose pajamas that you might get tangled up in. Sometimes I recommend a smoother t-shirt, like a polyester or nylon type of fabric, an athletic wear shirt, and then same thing for the shorts or the bottom. So something that's a little smoother. There is a company called Comfort Linen that makes a bottom sheet that's fitted with a chunk of satin on the top half of it so that it's easier to move as well. So you can explore different types of sheets and bedding. Consider a bed rail or a commode if that makes it safer for you at night. Eliminate extra covers that might be weighing you down when you're trying to move or get in or out of bed. I often recommend a lightweight down or down alternative comforter inside a duvet. So then you can eliminate the top sheet and then you only have to wrestle with one cover. A bed cradle is a device that you would put at the foot of your bed, and that helps elevate the comforter or your covers up off your feet so that you're not getting your feet tangled. And then generally firm mattresses are better than soft, squishy, memory foam mattresses that you might get stuck in. These are some examples of other things you can add for comfort. So different pillows, different wedges might be useful. Often in the bottom left, that's an example of a long pillow that you can, if you're sleeping on your side, you can put between your knees, and then it can also go under your head. So sometimes exploring just some different pillows for comfort can be useful. Another thing to check are your night lights for overall safety. We don't want you to fall at night. So these are some examples of different night lights. The idea here is to get the right intensity so it's not too bright, that it's interrupting your sleep cycle. The picture at the bottom is an example of a motion detecting under the bed light. So when you bring your feet over the bed, the light automatically comes on, and that helps illuminate your path. These can be set on timers, so again, they're not on all night, and then they'll go off when you're back into bed. With the advance of technology, smart homes, smart lights, etc., you could probably find some different light options that you would connect. If you're using that type of system, you could connect it to your smart home device. Another idea is you could get if you're using a walker, you can get a small little flashlight that attaches to the walker, and then you would turn that on to help, again, shine a path to the bathroom. This shows an example of a strategy we might teach to help get yourself in bed in the right position. This gentleman has his pillow placed near where he wants to sit. Often we get seated too far close to the head of the bed or the foot of the bed, and then we're wrestling to get ourselves positioned in bed. So you can put your pillow where you want to sit, and then he would slide that pillow to the head of the bed or turn it over, and then that gives him a good target for where to land. And the last area we're going to talk about today are daily routines. And ask yourself these questions. Do I get up and go to bed at predictable times? What do I do to stay active during the day? And what do I do to get ready for sleep? Our routines at night to get to sleep are just as important as our routines when we get up in the morning ready for the day. When you do small things like brush your teeth, put your pajamas on, read, or dim the lights, those are signals to your brain that it's ready to go to sleep. You can consider restructuring your daytime activity. It's important to get outside in natural light. Or if you're in home, make sure you sit in a room or you're in rooms that have a lot of natural light. It's helpful to have regular meal times to add structure to your day. Just avoid big meals close to bedtime. So the overall idea with daily life or daily routines is to increase your awareness of what you're doing during the day and what you might add. What activity might you add to your day so that you're more active? And lastly, as rehab therapists, you hear this from us that it's important to exercise and get physical activity to help manage symptoms. There's lots of positive benefits to exercise and movement, and now improving your sleep can be added to that list. Just try to avoid big, heavy workouts a few hours before bed, and sometimes it might be useful to do some light stretching once you're getting ready to get into bed or even in bed, just to help manage some of the rigidity or stiffness you may be feeling. That concludes my portion of the sleep talk this morning, so I will turn it over to the next speaker, and thank you very much for listening in.
Hi, I'm Lacey Severson, and I'm a clinical social worker. I work at Struthers Parkinson Center, Park Nicollet in Golden Valley. We are a Parkinson's Foundation Center for Excellence, and I'll be speaking with you today about coping with sleeping challenges and what are some cognitive and behavioral strategies for doing so. The objectives for today's presentation is to explain a little bit about what cognitive behavioral therapy is, which is the lens and a model that we'll be kind of looking at addressing sleep challenges through during this presentation. Also talk about what is sleep hygiene, stimulus control, relaxation techniques, and cognitive strategies, all of which I will get to and explain in more depth as we go. So cognitive behavioral therapy, what is this? This is a very common and widely used psychotherapy model that essentially is focusing on a person's thoughts, feelings, and behaviors and how those interact and impact one another. And the idea of this model is that if we change one of these things, then we can shift the others as well. So for example, if someone has a specific thinking pattern, that's really not serving them, maybe exacerbating an issue, we think about, how can we change the thinking pattern, and then that may influence their feelings and then the behaviors that they have due to those thoughts or feelings. So that's how we've kind of looked at sleeping challenges as well can we address that through some cognitive or behavioral interventions to improve sleep. What do we know about cognitive behavioral strategies specific with Parkinson's and related to sleep challenges? Of course, we know that many Parkinson's patients experience symptoms related to sleep disturbance. I found a statistics that was 98%, which is very high, but I was not very surprised to hear that often here and the people that I meet at the clinic. And we know that there's been a couple, different studies and ways that people have tried to implement cognitive and behavioral strategies. There was a 3-day sleep management course taught to some community health professionals. This took place in Scotland. And there were some very positive patient outcomes. They had decreased anxiety associated with their sleep issues. They felt better able to manage their sleep and have a sense of control over their sleep as well. We know that CBT or cognitive behavioral therapy, it's a very evidence-based treatment that's been used to treat insomnia. And there have been many studies that demonstrate its efficacy in treating those symptoms of insomnia, which, many individuals with Parkinson's also experience. So there's a lot of, kind of research behind there and things that are kind of telling us, yeah, this would likely work with, Parkinson's patients who are experiencing some of these similar symptoms that people who have insomnia experience. There's been a longer study, pilot study that showed CBT was an effective intervention in improving people's quality of sleep that they reported. But with that, there certainly is more research to be done with applying cognitive and behavioral therapy types of models and approaches. So we can really determine the best way to treat sleep challenges in Parkinson's patients. If this is the right way to keep on going, is using these cognitive behavioral strategies or maybe specific ones. So I hope that research and those studies continue. So sleep hygiene, so kind of a fancy word saying, looking at sleep routines, behaviors, and we're also looking at environment, where you're sleeping and what that looks like. So we're encouraging you to take a look at that and maybe make some changes to that. Creating a really comfortable, almost Goldilocks environment that suits you. Looking at your light and noise, do you need to reduce that? Adjust temperature to your liking, not having it too hot or too cold, but just right. Do you use some blankets and take some off as needed? Covering your alarm clock or phone just so you're not looking over at it and constantly checking the time, which causes you to probably be more frustrated or anxious, which is not going to help you be relaxed to be able to sleep, kind of working against what we're aiming for. Limiting caffeine, alcohol, tobacco. We know those things can be stimulating. Not using those before bedtime, and certainly not during the nighttime either if you're getting up. Going to bed full and feeling fit. So don't go to bed feeling hungry, and exercising regularly helps with sleep and just your overall, of course, well-being. We know that that's something we encourage Parkinson's patients to do anyways, but being mindful of when you're doing that, they do suggest, 3 or more hours before bedtime, just so your body has some time to kind of wind down and kind of get ready for bed. And getting up at the same time each day to set your biological clock. So regardless of when you go to bed, always setting the alarm clock and just getting up at the same time, that can help. avoiding naps during the day if possible. You know, for some people that's not the case, and people do need those naps. But sometimes it does help to cause a little bit more sleepiness, or really help you be ready for bed at night. Staying in bed only when you're sleepy, and leave the bedroom if you're awake and not able to sleep. You know, don't force it. That's you know, probably the you know, most counterproductive thing you can do is trying to sleep. We don't want you to be trying too hard, because that'll make it even more difficult. Stimulus control. So this is association with the bed, bedroom, and bedtime, and limiting the amount of time spent awake in the bedroom, as well as the kind of behavior that is occurring in the bedroom. So lying down to go to sleep only when you're feeling sleepy, you know, so not even going into the bedroom when you're even somewhat awake, you know, so wait till you're really feeling sleepy. Limit activities in the bedroom to just sleep and sex. Those two things are going on, nothing else. You know, some people like to, you know, camp out in their bedrooms. It can be a comfy place, or people have a TV in the bedroom, but just really trying to limit that. So your body associates your bed and your bedroom with sleep or sex, and only those things. Get up and leave the bedroom if you're awake for 15 or more minutes. So if you're laying in bed, just staring at the ceiling, and spend 15 minutes, get up, leave the bedroom, go do something else for a while, and then only return to bed only when you're feeling sleepy. So that's kind of the stimulus control to really strengthen that association between your bed, your bedroom, and bedtime, right? That's for sleep or you know, sexual activity. But because we're talking about sleep, we really want to strengthen that association and work on that. Relaxation techniques. These are, you know, primarily behavioral focused, right? Some actions that you can take, some different approaches to kind of calming your mind and body. One I work with people on is breathing. You know, there's many breathing exercises out there. And so, you know, I don't know that there's any right or wrong way. I think the point is to make sure you're focusing on your breath and making sure it's paced. One example is, you know, breathing in for 4 seconds, holding it for 4 seconds, and then having your out breath be 6 seconds. So just a few seconds longer than the others. And I encourage people to make that out breath as long as they can. Just because that really helps your body relax, and it does prevent hyperventilation if, you know, you're just trying to catch your breath and you're feeling anxious as well. Progressive muscle relaxation, that's where you can go through and kind of target different muscle groups or areas of your body, and you kind of tense them up, like your shoulders, you kind of tense them up for a few seconds, and then you kind of let them go, and that can create a very calming, relaxing feeling. A body scan, kind of similar to progressive muscle relaxation, where you can go through, you know, from head to toe, different areas of your body. Some people, you know, try and, you know, think about a, you know, warming sensation in that area, or just, you know, going through and checking in with your body and where there may be some pain, where you could, you know, give it some love, and going through that way, and that can kind of be relaxing. Meditation, there's a lot of great technology and apps out there that people use. There's, you know, guided meditation. There's even just background noise if you just want to listen to some naturescapes or things like that. Some are listed here: Calm, Headspace, Insight Timer. Last is sensory engagement. And so that's, you know, engaging your 5 senses, what you hear, see, smell, taste, and touch. You know, what's your favorite scent? Essential oil? Is there a tea or a warm drink that you can have, or hold and sip, engage more than one sense. Is there a fabric, something textile, or tactile that feels good or comforting to feel? So those are some behavioral relaxation techniques. And then lastly, some cognitive strategies. So we know that a lot of people experience having difficulty calming down their mind at night. And so these are some strategies to kind of help do that. One is to use some distraction techniques to reduce, distress of negative or worrying thoughts, doing some mental lists, and that would be, thinking of all the cars you owned, or, who were your grade school teachers. They can, to be exciting things. In fact, it's better if they're mundane. We don't want it to be too stimulating, right? And get your mind going too much. Just something enough to distract your mind so it can get kind of sleepy again. Counting, some people use that, counting backwards or whatever that may be. Using imagery, thinking about, where's your happy place? What is something that's calming to you, and imagining that. So using that kind of technique. Another thing I suggest to people is to write down your thoughts, whether that be a to-do list, your journal. It's identifying a repetitive thought or topic, put it to paper, and then put it down and put it away until tomorrow. The idea is that, okay, you've kind of gotten that out of your mind. It's there. You don't need to be concerned about it at this moment. You've got it somewhere where you can address it at a later time. And then lastly, challenging negative or worry thoughts. I do this a lot with people who have anxiety and have those worry thoughts, and those can kind of just spiral and kind of you get stuck in those. So some things you can do are, put your thoughts on trial. What are the facts? What do I know for sure about this? What's the likelihood this is true or will occur? And you kind of base that on your experience or other evidence you've collected. If it does happen, what's the worst, best, most likely outcome? And what would I do if this happened? What are some steps you can take? And will this still be important in 1 month, 1 year from now, or 1 week? So those are just some ways to challenge the worry thoughts, and that kind of reduces the anxiety, puts things into perspective a little bit. So those are some cognitive behavioral strategies to address some sleep issues. I hope that those are some practical tips and really helpful. Here is my reference page for some of the studies, as well as some of the resources that I used regarding this topic. Thank you so much for listening, and I hope you're able to tune in to the rest of the Progress and Possibilities series. Have a great day.
Well, thank you to Dr. Johnson, to Lori McManus, and to Lacey Severson for sharing their tips about sleep. I think we have 7 minutes to sort of answer questions, and I thought I'd just start by reiterating that sleep is really important. You can deal with yucky stuff during the day much better if you know that you'll get release and relief at night. So sleep is important. It's important to feel that you can talk to your physician about it. It's important to talk to family members about it. The second point is that sleep issues in people with Parkinson's disease can get really complicated. There are many things that can occur at night, some of which are related to Parkinson's, some of which are not. We didn't even mention things like sleep apnea. Lori alluded briefly to the idea that people with Parkinson's sometimes wake up at night because they have to use the bathroom, and then sometimes it's hard to get back to sleep after that, depending on how involved the process of going to the bathroom might be. People can have pain. Depression can lead people to be lying awake, ruminating or worrying or being anxious. So there's all sorts of things that don't have anything to do with Parkinson's that can affect sleep. And then there's the things Dr. Johnson talked about that we sort of associate with Parkinson's. So it can be complicated. Should it be managed by the primary care doctor or the neurologist? Depends on how complicated your issue is. I think sometimes it's easier to connect with your primary care doctor or to try something simple that's over the counter. It certainly is simple to just get an app for the phone that might help provide some white noise to allow someone with insomnia to kind of relax and go to sleep, or some of these what we call sleep hygiene strategies that Lacey described. The idea that bed is where you sleep, and what you do when you're in bed is sleep, and don't allow yourself to sleep in the recliner or doze off on the sofa. If you are sleepy, go into the bedroom and sleep. And if you are not sleepy, then don't be in the bed, and don't be lying in bed reading books, writing letters, eating, watching TV. Then you're training yourself that bed is a place that you do all sorts of things. Someone asked what a short nap is. I think I answered that in the chat room. Somewhere between 5 minutes and an hour. It's better to take naps earlier in the day than later in the day. There's a normal dip in our biorhythms after lunch. So in many countries, it's permissible at age 20 to have a little snooze after lunch, and we call it a siesta. So probably the most natural time to have a nap would be after lunch. What about we got into a conversation about apps for Parkinson's. That's a slightly different topic. And I would just, if it was me, I would go to Dr. Google and Google apps for Parkinson's disease. What app would be helpful for you depends on what problem you're trying to solve. So there are apps that record your sleep. There's apps that record movement and tremor. There's apps that help remind you to take your pills on time. There's apps where you can maybe record what your symptoms are from moment to moment or hour to hour. There's apps that can, you heard about some that can help with sort of white noise or relaxation. So again, what app would work or be helpful to you depends on what problem you're trying to address. And then there was a question in the Q&A. This kind of describes how complicated sleep can be. I'm noticing that I have trouble staying alert while driving for over an hour. I have trouble sleeping, vivid dreams where I wake up after I cry out or talk in my sleep. And I wake up several times at night to roll over, go to the bathroom, or my hip hurts. I have pain. I'm taking melatonin. I reduced the carbidopa levodopa before bedtime, trying to reduce the vivid dreams. Is all this related to Parkinson's, or am I just getting old? So again, this is a description of how complicated things can be. Pain in your hip area is probably a hip problem. And if that's kind of what's waking you up at night, it may be that plain old Tylenol or Advil will be as helpful a treatment as all our fancy prescription drugs. We talked a little bit about going to the bathroom. It has to be safe. And it is a challenge for some of our patients who are up multiple times at night and turn the lights on and so on. And by then you're fully awake. There are pills to help slow down an overactive bladder. Those pills are not without their own potential side effects, but that would be something to consider. How do you manage the vivid dreams or the acting out the dreams? Like everything else in Parkinson's, it comes in mild, moderate, and severe. Mild, I think of as somebody who's just talking or mumbling or calling out. Moderate would be hitting and kicking, and severe is somebody who actually gets up out of bed and does complicated things. That potentially, the severe, it could be life-threatening if you're in the wrong place at the wrong time. For instance, if you're sleeping in a loft and you get out of bed and climb over the edge of the loft. And there's also how often does the problem occur? Is it every night or is it once a week? Dr. Johnson noted that there are medications that we can use. So for people with severe REM behavior disorder or nightly activities, sometimes a little bit of medication at bedtime, melatonin or clonazepam can help to simmer down the frequency or severity of the episodes. It is also okay. Usually there's a little bit of mumbling or wiggling or something before a big explosive hit or kick or climb out of bed. So I often will say to bed partners, if you hear the person starting to rouse a little bit or mumble or say things, just give them a little poke and say, roll over, honey. It's okay to do that. It's better to do it before it escalates into hitting and kicking. And if you just talk about it ahead of time and you give each other permission to do this, then that will sometimes help. I have some patients or some couples where they end up sleeping in separate bedrooms because it is such a nightly activity and it's been dangerous, or maybe you start out sleeping in the same room, but one or the other partner moves to another bed at some point. So it's kind of complicated. Please make sure that you talk to your doctor, talk to each other about your sleep issues, and there's all kinds of things that can make it better. So now that we've slept for an hour, I've asked Laura Des Hotels, our physical therapist, to kind of wake us up a little bit. So Laura, can you help get us going with a little Tai Chi?
Yes, good morning, everybody. Happy to be here with you. So as you've heard several times today, exercise is certainly something that can help you sleep a little better at night. You know, something I see a lot in my day-to-day is that if you're not sleeping well, that can also have, you know, a negative effect on your walking and your balance. And so what I want to lead you through today is a form of Tai Chi. It's called Tai Chi Quan, moving for better balance. And it's really focused on improving balance and preventing falls. We actually are going to be starting a Tai Chi Quan class at Struthers Parkinson Center coming up in October. And we'll definitely get you guys a little more info on that before I say goodbye today. Let me get my camera positioned just the way I like. And so we are going to start sitting in a chair. We are going to get up and move around a little bit. You know, depending on what works for you, if you need to stay in the chair, stand up, hang on to the back of a chair as you move around, kind of adapt whatever works for you this morning. So starting at the edge of your seat, we're going to start with just 3 deep breaths. First, I'll have you let all the air out of your lungs, and we'll take a nice deep breath in, palms face up towards the ceiling. Breathe out, palms push down to the ground. Again, inhale, palms to the ceiling. Exhale, palms down. One more inhale. And exhale. Next, we're going to add a little more to that as we inhale, shift your weight forward in your chair. Exhale, sit tall. This time, as we inhale, your hips will lift up off the chair. Exhale, lower back down. This time, as we inhale, we're standing all the way up. Arms reach overhead. Exhale, we're sitting all the way back down. Those 3 breaths one more time. Inhale, shift your weight forward. Exhale, sit tall. Inhale, hips lift up off your seat. Exhale, lower back down. Big inhale, rising all the way up, arms reach overhead. Exhale, arms by your side. Let me make one more adjustment. You'd think I'd be better at this by now. All right. So staying on our feet now, what we're gonna do is take a breath in, shift your weight to the right. Exhale, take a comfortable step, widen your stance. This time as we inhale, we're gonna shift our weight back into the heels. Feel those toes start to lift up. Exhale, return to center. Inhale, this time weight shifting into your toes. Feel the front of your ankles start to grab. Exhale, return to center. Again, we're gonna inhale, weight shifts back into your heels. Exhale, return to center. This time, inhale, shift that weight forward into your toes. Maybe a little further so those hips start to interact. Exhale, return to center. Inhale, shift your weight to the right. Exhale, hold the ball pose. So this will be one of our positions we come back to again and again. Most of my weight is in my right leg. My left toes are resting lightly on the floor and I'm holding my ball out to the side. So now we're going to start to move the ball from side to side. And so what that's going to look like, I'm going to take a breath in. Exhale, step to the side and move my ball. Inhale, feet together. Exhale, settle. Just like that, side to side, we're gonna inhale, take a step. Exhale, move the ball. Inhale, feet together. Exhale, settle. Good. Inhale, step. Exhale, move the ball. Inhale, feet together. Exhale, settle. One more time, side to side like that. Inhale, step. Exhale, move the ball. Inhale, feet together. Exhale, settle. Inhale, step. Exhale, move the ball. Inhale, feet together. Exhale, settle. Now we're going to add a little forward and backward diagonal movement to moving the ball. And so what that's going to look like, I'm going to inhale, exhale, move the ball as I take a diagonal step forward. Inhale, feet together. Exhale, settle. One more time, we're going to inhale, step forward to the diagonal, move the ball. Inhale, feet together. Exhale, settle. Now we're going to reverse, take a diagonal step, moving back to the chair. Inhale, take a step. Exhale, move the ball. Inhale, feet together. Exhale, settle. Inhale, take a step back. Exhale, move the ball. Inhale, feet together. Exhale, settle. One more time, back and forth. We're going to inhale, take that step forward. Exhale, move the ball, shift your weight forward. Inhale, feet together. Exhale, settle. Inhale, step forward. Exhale, move the ball. Inhale, feet together. And exhale, settle. Very good. Inhale, step back. Exhale as you move the ball. Inhale, feet together. Exhale, settle. Last time, inhale, take a step back. Exhale, move the ball. Inhale, feet together. Exhale, settle. Very nice. We're gonna inhale and exhale. Widen your stance. Come into a comfortable position. All right. Next, we're gonna move through some limits of stability practice, kind of shifting our weight, taking some steps. One thing I really liked about the instructor who I took this course from, she said, improve your limits of stability, expand your world. And so what this is gonna look like this morning, we're gonna inhale, shift your weight into your toes. Exhale, return to center. This time we're gonna shift a little further forward as you breathe in to the point where your hips wanna pop out a little bit. Exhale back to center. This time we're gonna add a step to that movement. Inhale, shift the weight to your toes. Hips pop up. Take a comfortable step forward. Good. So we're really using a lot of our good balance strategies with this move. We're gonna try again using your other leg. Inhale, weight comes forward into your toes. Hips pop up. Comfortable step forward. Very good. Again, we're gonna go back to your original leg. Inhale, shift your weight forward. Hips pop up. Comfortable step forward. Very good. Other side. Inhale, weight shifting forward. Hips up. Step forward. Wonderful. We're gonna do something very similar this time in a backwards direction. So what we're gonna do, inhale, weight shifts into your heels, keep shifting, shifting. Take a comfortable step back. Good, return to center. Other leg this time, inhale, weight shifts into your heels, shift, shift, shift. Take that comfortable step back. Very nice. Again, coming back to that first side. Inhaling, weight shifts back. Shift, shift, shift. Take that comfortable step. Very good. One more time. Return to center. Inhale is just shift your weight into your heels. Comfortable step back. Very nice. So, again, with this form of Tai Chi, we're really addressing all different areas of your balance. It is a protocol that has a lot of evidence behind it to support that it really helps to prevent falls in people with Parkinson's by up to 67% is what the literature says. So I know some of the information you're going to be getting at the end of the day will include my email address and contact information. If you're in the Twin Cities area and you're interested in checking out our new balance class, it's something that we're going to be offering again starting in October. It's twice a week for 3 months. And I think whether you're already concerned about balance or you're looking to reduce falls, we would love to have you in class. So I would love to hear from you if that sounds like something you're interested in. Again, I think not only does this Tai Chi help with balance, there's that relaxation element, all things that I think can really help you sleep well. So thank you so much for getting up and moving around with me this morning. I hope you're feeling a little energized for the remaining part of our conference today. Thanks, everybody.
Well, thank you, Laura. Anybody think she did a good job? Raise your hand if you think she did a good job. If you know how to raise
Thank you
your hand.
so much, everybody.
So So I did want to remind everybody that the session is being recorded. So if you want to come back to it later, you can get to it through the Parkinson Foundation website. And really encourage you to pass it on to others. Is the Tai Chi class available by Zoom? I think that the Tai Chi class is going to be in person. We do have some things we're doing by Zoom, and again, if others who are attending the conference have been, there are any number of exercise groups and classes that people can connect with by Zoom, either Parkinson specific or not Parkinson specific. So again, let others know in the chat room if you've been involved in a class that you have really found to be helpful. So we'll start our next session, which is about cognitive changes. The speakers will run from about until about 10:50. We'll have a few minutes for questions, and then we'll have another 10-minute break at 11 o'clock before we begin our third session, which is the one I'm looking forward to, about being optimistic. But first, let's talk about what happens when there are cognitive changes. And I think, we downplay this at the time of diagnosis, because often the first symptoms people have are more related to movement. But as the years go by, I think it often becomes more and more noticeable to people that they're not only slowing down physically, but they're having some cognitive changes, maybe slowing down cognitively as well. So let's talk about it. I've asked Kate Wyman-Chick, who is a neuropsychologist at Struthers on the east side, and Melissa Pellinen, who's a speech language pathologist at Struthers on the west side, to talk about cognitive change from two different perspectives. The neuropsychologist and the speech pathologist really view it from different perspectives. How do you diagnose and how do you manage cognitive change? So let's go ahead with Kate and Melissa. Thank you.
Hi, thank you so much for the opportunity to speak today. My name is Kate, and as it was mentioned, I'm a neuropsychologist. Many of you likely know what neuropsychology is, but for those of you who don't, basically we're psychologists who specialize in brain and behavior relationships. We really like to focus on cognition and mood to try and help diagnose certain conditions and also help with treatment planning. And today I'll be talking to you about some of the cognitive changes that can happen with Parkinson's disease. First, I would like to define cognition. There are many definitions available, but this definition is actually from the Parkinson Foundation resource on cognition. And they define it as the action or process of acquiring knowledge and understanding through thought, experience, and the senses. When we think about cognition, certainly we know things change over time. So when we're young, we begin to acquire knowledge and skills. However, in adulthood, there can be very normal changes that are associated with age. For example, finding the word you want to say, or maybe the name of an actor or a restaurant, that starts to become more difficult in your 40s, and then it doesn't get easier over time. So some things are very normal with age. You may have heard the term mild cognitive impairment, which really means there's been a change in thinking abilities that is maybe more pronounced than we would expect due to normal age. However, those changes are not getting in the way of someone's ability to do day-to-day tasks. So someone can have some changes in thinking abilities, but still manage their finances or manage their medications and medical appointments. When we talk about the term dementia, that really means now there's been a pretty significant change in thinking abilities, and someone now needs a lot of assistance with some of those day-to-day tasks. And this change. So mild cognitive impairment and dementia can happen for a number of different reasons. However, one way by which someone can experience these changes is related to having Parkinson's disease. So we're talking about cognition today within the context of many different non-motor symptoms. And again, these changes can be very mild for some individuals, and for others, it may be more significant. Some research that I've published tells us that cognitive impairment is pretty common in Parkinson's disease. So within about 2 years of diagnosis, several individuals, 30 to 40% of the sample, had some changes in thinking abilities. These changes were mild, and people were still working, and they were still doing the things they need to do during the day. But I think it is important to highlight that this can be an important non-motor feature to pay attention to. The likelihood of cognitive problems does increase as we get older and with the length of Parkinson's disease. So the longer someone has Parkinson's disease, the more likely they are to experience some changes. And again, sometimes those changes can be very mild, but up to 80% of individuals with Parkinson's typically have some evidence of a change in their cognition after 20 plus years of having the disease. So not everybody, but it is something to be aware of. So now I'd like to talk about different aspects of cognition because some things change with Parkinson's and some things are less impacted. So we'll start with focus and attention. This is often impacted earlier in the disease process. So we think about difficulty maintaining focus in a conversation. Maybe you've had the experience where you were at a busy restaurant or you were trying to have a conversation when the TV is on. It is just more difficult to sustain attention on one thing when there's a lot of distractions. Sometimes this can look like the phone rings and someone can become distracted and then they forget to come back to the task that they were working on. This can also be, this can also occur when you're trying to do something and you kind of just lose your train of thought, or you get distracted by something and then you forgot what you were working on. Processing speed is also an important cognitive domain. And with Parkinson's disease, we can see that sometimes people slow down physically, but they can also slow down with their thought processes. So it can take longer to process information that someone is providing. It can take longer to formulate your response. And so this is really important, especially for friends and family members to recognize it may be difficult for your loved one with Parkinson's to keep up with a really fast-paced conversation. Not only can that be difficult, but they might not be able to kind of jump in and share their ideas. And sometimes people become more withdrawn, or they don't socialize as much as they did in the past. It can also come across with maybe jumping in when someone is still thinking about what they want to say. And certainly, I think we've all possibly been guilty of that, but really thinking speed does slow down, and we need to pause and allow individuals to be able to engage in the conversation. Executive functions are a variety of different skills, and this is probably one of the most troublesome aspects of cognition in Parkinson's when people start to have change. So I think about executive functioning like the executive of a company. Organization, multitasking, planning, could even be problem solving. I mean by abstract thinking, being able to incorporate new concepts or think about something from several different perspectives. Sometimes people can become more fixed or rigid on an idea. And then also kind of monitoring your work for mistakes. So maybe not able to catch typos like you used to. For individuals who are still working, sometimes executive functions begin to change and it becomes much more effortful, or it takes much longer to maintain the same level of work that you did in the past. So this is something to keep in mind, that this is a big area that can change with Parkinson's. Visual spatial abilities are a little bit trickier to identify day to day. And what I mean by that is you can maybe see if someone is having attention problems or if somebody is struggling with organization. It can be a little more challenging to identify differences or changes with visual spatial abilities. This can look like difficulty judging distance, could look like difficulty parking between the lines. Changes in visual spatial abilities can contribute to an increased risk of falls, can also put someone at risk while driving. We've also learned over time that changes in the visual system or the visual pathway in the brain that occur with Parkinson's disease may cause difficulty perceiving items in low light settings. And so this may be where someone might have a misperception. For a moment, something can look like someone is standing there, or for a second, maybe a pile of shoes, maybe it looks like an animal, and then someone looks a little more closely and they say, oh no. So these misperceptions, not necessarily even hallucinations, but these misperceptions can occur due to some of these changes in the visual abilities. So memory can be impacted in Parkinson's disease, but it looks different than the type of memory problems that somebody has when they have Alzheimer's disease, for example. With Parkinson's disease, there can be trouble paying attention to the new information and then organizing the information. So typically what happens is if someone is able to focus and learn the information, you store it in your brain, and then you have to find that file. And what often happens with Parkinson's, if someone stores the information, sometimes they can't always recall the conversation. More likely than not with Parkinson's, cueing can be helpful. You say, well, you know, we were standing in the kitchen when we talked about this. Sometimes that's helpful. Sometimes they weren't focused or paying attention when the conversation was happening. And so that can be an important thing to keep in mind. If you are communicating something really important, making sure the television is off or there are no distractions, and really kind of engaging can help with the memory process with Parkinson's. It does seem to be more impacted by that organizing the information, retrieving the information. Whereas in Alzheimer's disease, people have a lot of trouble creating new memories. So it can look a little bit different. But we will talk about some strategies for memory later in the presentation today. So unlike difficulty with visual spatial skills, we really can pick up on language difficulties when we're having a conversation. This is a little bit easier for someone to notice that maybe there's been a change. Word finding problems, again, start when we are in our 40s and continue to become more difficult over time. Patients with Parkinson's disease sometimes need more time to retrieve the word that they want to say. If they feel a lot of stress or pressure, it may be the word just might completely disappear. And we think about that tip of the tongue where it's like you can almost find the name or the word, but you can't quite. Or somebody may have some word substitutions. So they're talking about a towel, but they might say the word blanket. And so you can probably figure out what they're talking about, but it's not the word that they wanted to use. These are more typical of the language problems with Parkinson's. Many different things can also impact our thinking abilities. Depression, anxiety are very, very common in Parkinson's, and they can certainly make it more difficult to focus and to think quickly. Pain, stress, if we're not sleeping well, if we have a lot of fatigue. Certainly if somebody has a lot of confusion, we think about checking in with the doctor and making sure there's not an infection, and other medical conditions. So diabetes, we have fluctuations in blood sugar. If someone has other risk factors for changes in their memory or thinking abilities, like heart disease, for example. So there's a lot of things that can contribute to cognitive problems in patients with Parkinson's. Some of these things are treatable, and it's important to be able to identify what may be contributing to some of these challenges that people experience. So how do we identify those changes? The first is a brief screening measure at your physician's office. You may have done this before at your doctor's office, or even possibly as part of a research study. But basically what we have are these tools that we've given to hundreds, if not thousands of people. So we kind of have an idea of what is normal and what's normal for certain age ranges or certain levels of education. So when we are able to kind of administer this, we can kind of have a kind of ballpark view of where somebody is at. But again, there can be difficulty with thinking abilities for a number of different reasons. Another way is to come see a neuropsychologist. And basically, when I think about these evaluations, I think about identifying the strengths. If there are weaknesses, how do we use those strengths to keep you moving forward? What are other potential causes of thinking problems, and how can we keep your brain healthy and optimize quality of life? So with neuropsychological assessment, it is more in depth. However, I feel, I might be biased, but I feel like we're able to make some good recommendations to help people continue to move forward. So basically, we've reached the end of this section, and Melissa, our wonderful colleague, is going to talk about what we can do about some of these cognitive changes and how to continue to keep your brain healthy. Thank you for your time.
Good morning. My name is Melissa Pellinen, and I am one of the speech pathologists at Struthers Parkinson Center in Golden Valley. Along with working with patients who have Parkinson's disease on their speech and their voice and their swallowing skills, I also help people out when they're noticing cognitive changes in Parkinson's disease. So Dr. Wyman has already reviewed some of the cognitive changes you might notice with Parkinson's. Today, I would like to talk to you about some things you can do about those changes. So I'm going to start by talking directly to people with Parkinson's about compensatory strategies you can use when you're noticing some changes with your thinking skills. And then I have some tips for care partners for what you can do to optimize communication and recall and cognitive skills when you notice changes in Parkinson's. And then we'll talk about some exercises that can be done to help cognitive skills with Parkinson's disease. So first, going to the slides addressing cognitive compensatory strategies. Just in general, one recommendation that all of us make at Struthers is to take your time. Try not to rush. You have probably noticed that the more rushed you feel, the slower you go with Parkinson's, both physically and mentally. Stress can increase your Parkinson's symptoms and make things more difficult to do. So if you're feeling time pressure, if you're feeling that urgency to get words out or to think of a memory you're trying to come up with, you're going to have more difficult than if you can decrease the time pressure in any way. So one way to do that is to socialize in smaller groups or one-on-one. I have so many clients say that they go to larger gatherings like dinners with a big group of friends and they don't get a word in edgewise because the conversation moves too quickly. So with that slightly slower processing, it's really hard to make your way into a conversation. By the time that you've formulated what you want to say on a certain topic, the topic has shifted to something else, and it would be inappropriate to say, oh, back up, I have something to say about that. So if you don't feel comfortable letting a larger group of people know, hey, I need a little bit of extra time. When I raise my finger, please stop and listen. Then try calling just one friend instead of that group of 4 that you used to like to get coffee with, and socialize one-on-one so you get more of a chance to speak your mind. Minimize distractions when you are listening. With Parkinson's, a lot of things like moving around, getting yourself dressed, doing physical activity take a little bit of your attention. So if you're having a conversation while you're doing something physical, you might not remember what was said in that conversation later on because you were actually distracted by trying to button a button or get up to grab a cup of coffee. So if you're having a discussion and it's important, make sure that you're not trying to do something else at the same time. Also, just in general, doing one thing at a time is smart. Avoiding multitasking. All of us think that we're able to multitask, but actually we're probably only doing one thing well and one thing suboptimally. So choose, if you're going to cook a meal, cook the meal. Don't try to clean the kitchen at the same time as you're cooking. Or if you are having a conversation, just sit and have the conversation. Don't be trying to do a couple of physical things at the same time. And then for memory, get things down on paper. A lot of us pride ourselves in thinking that we can hold it all in our head and, don't keep a post-it of a to-do list at work and things like that. It is easier on your brain to get what you can written down so you don't have to remember, oh yes, I was going to tell my wife that her friend called. Oh shoot, I was going to tell my wife that her friend called. It's a waste of cognitive space to remember things that you could have written down. The act of writing things down helps you remember things better. Plus, if you forget it, it's written down. So stack the deck in your favor in that way. Some tips for word finding difficulty. I would say that, when I ask my clients what cognitive changes they notice, word finding is probably the #1 complaint that I hear people mention. So one tip that I have is to discuss with your partner whether or not you want them to answer for you. So a lot of times in conversations, especially at appointments and things like that, you might want your partner to bail you out and answer the question if you are struggling to come up with the words. But there are a lot of times where it's probably good for you to struggle a little bit and work hard to think of the words that you want to say so that nobody's assuming what you're going to say. So maybe you say, yeah, at the doctor appointment, please just jump in and answer for me. But if we're alone or if we're with close friends, if I'm starting to say something and I'm starting to struggle with the word I want to say, don't bail me out. Let me work on it a little bit because a lot of times it will come. When you are meeting with old friends or going to see the doctor or going to a religious service and you know who you're going to be seeing, maybe you're meeting friends and they have 3 kids and you want to ask after those kids, make sure you review their names ahead of time while you're on your way to the event so that you've kind of primed the pump and you feel a little bit prepared to talk about the people or the topics that you'll probably discuss in those situations. And then that last tip on this screen, keep a small notebook or an app with people's names or words you tend to have trouble remembering. I do that one. My daughters are in Girl Scouts and there are people that I see only once a month, and I don't know them very well, but I've met them several times and I feel like I should know their names. So after a meeting, when I catch somebody's name, I keep it on a note app, you know, Emily's mother is Janelle or something like that, just so that I can review those names before the next meeting. So when I see those people, I'm prepared and have their names handy. Tips for care partners. The first one has to do with that bradyphrenia that Dr. Wyman was talking about, that slower processing speed. That when you ask somebody with Parkinson's a question, to allow them a little bit of extra time to formulate their response. We are all so used to hearing people talking on top of one another. If you watch TV or late night interviews or the news, people just, there's not a minute of silence in between a question and an answer. With Parkinson's, sometimes people just need a little bit of extra time. So ask a question and then count to 10 in your mind, maybe 20 silently, before you assume that they didn't hear you or that they weren't listening. It is possible that they heard you and they are listening, but they just need a little extra time to formulate their response. Try to be eye to eye when you're communicating. So sit down across from one another. We are terrible about that at home, where we talk to each other from other rooms. People can't hear us. People don't know we're talking to them. So sit down, be face to face, especially when you are saying something that you're going to want the person with Parkinson's to remember and pay attention to. Try to keep on the same topic during a conversation. I am guilty of doing this myself, where I start telling a story and then oh, that is something else, shift to something else, shift back to the initial story. That can be really hard to follow if you have some processing speed issues or some attention issues. If you get a little bit distracted during a conversation because you have Parkinson's, and then when you tune back in, your partner's talking about something else completely, that can be a little disorienting. So try to keep it at one topic at a time as much as possible in a conversation. And then keeping things simple when you're offering choices. So, you know, if you're cooking supper and you ask this open-ended, what do you want tonight? The person with Parkinson's has to think through, you know, what do I feel like? What do we have on hand? All of those questions that we ask ourselves when we're deciding on dinner. Make it simple. Do you want chicken tonight or burgers? Makes it a little more simple to process that hefty type information. Couple other tips for around the house. One is to keep the environment organized. I have a lot of clients and families who say that it's bothersome when somebody with Parkinson's is a little forgetful and asks the same question several times during the day, like, what are the plans for the day? So for some families, it really works to put a white marker board on the fridge with the plans just for that day. Today is Saturday. We have progress and possibilities in the morning, going for a walk in the afternoon. Put those two headlines on the whiteboard. Then if the person with Parkinson's can't remember what the plan was, you can say, look at the whiteboard, or maybe they know to look and check the schedule before they feel like they have to ask you. If you're the keeper of the calendar and they don't have access to that information besides asking you what it is, then you might have to answer that question several times unless you have it available for somebody with Parkinson's to check themselves. Also, keeping the household organized, you know, always put the keys in the same place, always put the glasses in the same place, or the 10 pairs of reading glasses in the same 10 places, always put the wallet in the same place, so things are easy to find around the house. I do like the idea of a morning meeting where you do sit down eye to eye, face to face, when you're not multitasking and the person with Parkinson's is not multitasking, so that you can talk about the day's plans where both of you are paying attention and can answer and ask each other questions. And then just with your day, try to keep a fairly consistent routine. Try not to overschedule the day. Fatigue is real with Parkinson's, so trying to run errands and go to 4 different stores can be way too much. Plus, with Parkinson's, it's harder to move quickly, so getting as much done in a day is kind of a big ask. So if you used to go to 4 different places when you would run errands, maybe think about cutting that down to 2 and see how the day goes. And then as a caregiver or care partner, do make sure you are making time for yourself. I am sure you've heard the phrase, you cannot pour from an empty cup. That is a true fact. So make sure that you are getting the rest and the exercise support that you need. Some ideas of activities to improve cognition. You can't hear it enough with Parkinson's. Exercise, exercise, exercise. It is good for your body. It is also good for your brain. Your brain is an oxygen hungry organ. So when you get nice, freshly oxygenated blood pumping to the brain, you can think more clearly. Same with sleep. All of us sacrifice our cognition when we're getting poor sleep. So if you are having sleep issues, talk to your doctor about ways to get better rest at night or naps during the day. Make sure your medications are on time every time. When you feel better, you think better. So make sure your medications are on schedule so you're feeling your best. There are plenty of research studies that show the use it to improve it philosophy works with brain function in Parkinson's disease. So one study that comes to mind for me is a Sudoku study where they took a group of people with Parkinson's and had them do one easy Sudoku puzzle every day for 6 months. They did baseline cognitive tests and baseline functional MRIs of the brain. And then after 6 months, they retested and they had a control group who didn't do an easy Sudoku puzzle every day. The group who did the easy Sudoku every day not only did better in their cognitive testing, but also their fMRIs, the brain function on imaging, looked better. So I'm not saying you have to run out and buy every Sudoku book in the world, but I think it does show that if you do something structured and objective that challenges your brain, it helps you build up your cognitive resource pool to help you think more clearly when you need it. So what cognitive exercise is best for Parkinson's? The cognitive exercise you do. So choose something you enjoy that also challenges your mind. Some ideas for card games would be that old concentration or memory where you put the cards down, face down, and try to remember where pairs are by turning over 2 cards at a time for your turn. Bridge, canasta, rummy, hearts, some of these games that you know and are familiar to you. It's nice not to have to learn the rules to a new game sometimes. So picking something that you know that's in your long-term recall and playing those games, you know, you need to make a plan. You need to remember your plan while it's the other person's turn. You need to be flexible in your thinking to adjust your plan if the other person ruins your plan with their turn. So card games are fantastic for brain function. Same with board games. There's the old familiar ones like Scrabble, which is great for word retrieval, but also the newer ones like Scattergories, where you have to name as many items in a category as you can. Catchphrase, taboo are describing words. Now, both those games have timers, which sometimes, again, with that time pressure can really stress you out with Parkinson's. So sometimes I say do away with the timer or double or triple or quadruple the time allotted in the game rules for those types of games. Games like Spot It and Quirkle involve a lot of visual processing, are really fun, simple to learn games that are good for the brain. And then the traditional Sudoku puzzles, logic puzzles, jigsaws, crosswords, great brain exercise to do on your own on any given day. Read, and read some more. Reading is great for the brain. If books are a little overwhelming to try to pursue because the print is too small or it's too long to get into, then grab a Reader's Digest. Read short articles that are enjoyable and interesting. This slide has some resources that might be appealing to you if you'd like to work to improve your cognition. Here at Struthers in Golden Valley, we offer some exercise classes to get that physical exercise for your brain. There's varying levels of intensity for exercise classes here. And the Struthers location in St. Paul, if you're in the East Metro, also offer exercise classes. There are some virtual voice classes that we offer on a nearly weekly basis, alternating between a choir and then a speech boosters class, which I teach. And we always sprinkle in some cognitive challenges while we're working with people on their voice in those groups. We have Create Connection sessions through Struthers Golden Valley, where you can come in if you have Parkinson's disease on Wednesday afternoons from 1 to 4 and do things like brain boosters, seated exercise classes, music therapy, and things like that. And if you're unable to come in person, we do offer this virtually as well. Online sessions are 90 minutes long and they're on Thursday mornings. Our support groups at Struthers right now are all virtual, and we have support groups not only for people with Parkinson's, early onset Parkinson's, newly diagnosed Parkinson's. We also have support groups for care providers and counseling services here at Struthers. Our caregiver skills building class is a class for people with Parkinson's, or for partners actually, care partners or caregivers, a monthly online class covering a variety of topics. So if any of these offerings sound appealing to you and you're not already clicked in with the Struthers resources, you can email spc@parknicolet.com or call 952-993-5495 for more information, or at the St. Paul campus, neuralwell@healthpartners.org, 651-495-6704. If you don't live in the metro area or some of these virtual classes are not appealing to you, some other options would be looking into companion aids or adult day programs in your community. Or if you're feeling just lost and don't know where to begin, it might help to touch base with a speech pathologist or occupational therapist in your area to get some ideas for cognitive exercises, evaluation of your cognitive skills, or to a physical therapist for some physical exercise ideas. You can also ask your doctor for a referral to neuropsychology if you're interested in a more in-depth cognitive evaluation. So those would be things you'd ask your doctor for a referral to. I appreciate your time. I hope that some information I provided today is helpful for you. Take care.
Well, thank you to both Kate and Melissa. I think those were wonderful presentations about strategies to deal with the cognitive changes that come maybe just with age, but also certainly with Parkinson's disease. We have just a couple minutes for questions. I think I would start with a couple comments. One person asked, and we didn't get to it with the last session, my loved one sleeps too much. What's that all about, and how do I deal with that? And I hope that that the last set of talks has kind of helped with that a little bit. Some of my patients end up falling asleep just because they're very inactive, both physically and cognitively. And so one way to deal with excessive sleepiness is to have more daytime activity. Another thing with both the excessive sleepiness and also with cognitive change, make sure that that you've been to the doctor and thought about, are there any medications you're taking that may be contributing to the problem? Dr. Johnson alluded to this way at the beginning, that some of the drugs we use for sleep can make people too sleepy. And so, you know, if you're taking a bunch of drugs that could be sedating, that may impact on cognition. Do you really need those medications? Can you lower the dose? So from the physician point of view, the first thing we think about with either cognitive change or excessive sleepiness is, can we back off on one or another medication? There are also medications approved on the market to treat Alzheimer's disease, and we do borrow those drugs sometimes in the Parkinson's clinic, and sometimes they help. There is research going on to develop treatments more specific for cognitive change in Parkinson's disease. At various times, we do not currently have a study that is still enrolling patients, but we have had a couple of studies within the last year that are really directed at treatments for cognition in Parkinson's. Couple other comments I would make about managing cognition in the home. One of the things you really want to do is set the person up for success. And it's the same kind of thing you did when your kids were young. You want your kid to play sports, but you don't want him to play in the A league if he's the smallest kid in the class. He may need to be in the B league so he can be successful. But you don't want him to be playing in the B league if he's, head and shoulders the best player on the team. You need a more competitive team for him to play with. So you want the person with Parkinson's who has cognitive change to have to push a little bit. You want the puzzle to be a little bit difficult, but not so difficult that you just throw up your hands and say, forget it. So when you look for cognitive activities, you want them to be a little bit difficult, but not too hard. And then I think both speakers alluded to the idea that trying to participate in big, huge groups with stuff going on, and a cocktail party setting where one person comes up from behind and claps you on the back, and then you're talking about the baseball game, and somebody else comes up and talks about back in high school, and you can't even remember what their name is. That's a very difficult situation for all of us, but particularly with the Parkinson's disease. People with Parkinson's may be more successful from both a cognitive and processing point of view, but also physically. It's hard to stand in the middle of a room with a crowd of people going this way and that. You may do better if you're off in the corner or off on the side, and that way you can only be accosted by one or two people at a time. And it's a quieter part of the party, and so if your voice is a little bit quiet, or if you're also a little bit hard of hearing, it may make the communication more effective. So again, setting up for success, don't feel like you have to be in the middle of the room and be the life of the party. It's okay to be on the side. Be thoughtful about what time of day is your better time of day or your worser time of day. For a lot of my folks with Parkinson's, once you sort of get going in the morning, wake up, take your pills, eat some food, do a little exercise, get your blood pumping, that often is the best time of day. And the evening, when you're tired and it's getting kind of dark outside and you can't see as well and hear as well, that often is not the best time for folks with Parkinson's. As we head into the fall and winter and kind of the holiday season and family events and so on, I often encourage my patients to just have a conversation with the family and say, we would do better with a noontime family gathering than a supper time family gathering. If we go to a supper time family gathering, we're going to leave early. We're going to be leaving by 8 o'clock. We don't like driving at night. And we don't like staying up late at night, and we get more confused. And so, could we do a noontime family event? So those are just a couple of tips I often share with folks. One of the attendees said, is it possible for a person to have depression and that would lead to sleeping all the time? Absolutely. There's two kinds of depressed people in the world. The ones who can't get out of bed and just kind of, lying in bed with the covers over their head, and why bother getting up? And then the other half of the depressed people are the ones who lie awake all night worrying and being anxious and can't settle down and can't get to sleep. So whenever somebody is sleeping too much, you have to at least consider the possibility of depression. Depression and anxiety can absolutely also impact on how a person functions cognitively. If I'm sitting here frantic about some horrible thing happening to a family member, or worrying about, whether I'm going to get to the bathroom on time or not, I'm not going to be thinking about whatever it is you're talking about, or sometimes I may not even be thinking about what I'm talking about because I'm worried about whether I took the roast out of the freezer for dinner tonight. So again, anxiety can absolutely get in the way of functioning well cognitively. And there are both pharmacologic and non-pharmacologic ways to deal with anxiety and depression. So make sure that you get these things addressed and talk about it, talk to your doctor about it, talk to your primary care doctor, talk to your neurologist, because there are ways to manage this so that you can be successful. So we will now take a 10-minute break. This is an unprogrammed or an unscripted break. So you actually get 10 minutes away to do whatever you want, a bio break or have a little snack. We will resume promptly at 11:10 for our third and final session, which is entitled Creating Joy and Optimism to Address Mood. And the speakers for that will be Meghan Krause from the Health Partners, the East Side WellBeing program, and she'll actually be live and in person. And then we'll hear a video at the end, just a short video from the most optimistic person I've ever met, a fellow named Mike Justak, who's a person with Parkinson's disease, who's made a little video entitled Overcome Parkinson's with Optimism. So let's take a 10-minute break and please come back ready to go at 11:10. Well, welcome back. It's 11:10, and so time to get started again. I'm really pleased to have in person from the Health Partners Wellbeing Program, Meghan Krause, to talk about how to create joy, how to create optimism and address mood. So Meghan, have at it. Thanks for coming.
Thank you. Thank you. Okay, so we're here today in part to explore ways to cope and to hope. Whether you're a patient with Parkinson's disease, maybe a caregiver, a loved one, or a healthcare professional. And as people of all ages seek relief for daily COVID-related stress, systemic oppression, mental ill health pressures, and what you may be facing in relation to Parkinson's, I'm here today to help you explore two powerful antidotes, the insights and practices of joy and optimism that can improve our immunity, our heart health, stress response, life expectancy, mental well-being, and so much more. It sounds almost too good to be true, doesn't it? Well, the great news is that there's a breadth of research to support the power of joy and learn to optimism. And so you're going to want to listen along so that you can apply these insights to your life. Now, to get started, let's create a shared experience of joy. If it's comfortable for you, I invite you to close your eyes and think back to a time in your life that felt joyful to you. It might be a time when you laughed so hard that it hurt, or when you felt completely free. Maybe it was a time when the world felt magical to you, or a time when you were surprised by the power of a simple pleasure. When you have this memory of joy in mind, I invite you to take yourself back there. Remember where you were, what was around you, who you're with, and what did the ground feel like under your feet? What was the light like? What were the sounds and senses involved when you're really back there in that moment? And now start to notice what's happening inside your body. What does this feeling of joy feel like to you? Is it in one place? All over? What's the color or shape you're noticing? And is there a temperature? Just take a little more time in this moment to notice what your joy feels like. And now you can open your eyes. It's helpful to start with this exercise because a lot of us are feeling little moments of joy throughout our days, and yet we don't always notice them. And so feel free to type in the chat, what did that feel like for you? What was your feeling or your physical sensations? Just make a quick note in the chat of what that was like. And by noticing these physical sensations of joy, it helps us to pay attention to more of those moments and to catch them rather than kind of losing them in the daily grind of life. And so here's the punchline for our time together today. We need to become serious about joy and optimism. Creating little moments of joy and optimism might seem trivial, but in fact, they're vital to our mood and our overall well-being. So, hi everyone. My name is Meghan Krause, and I'm really delighted to be here with you. I serve as an organizational well-being consultant for Health Partners, and I'm also a coach. And I love speaking and facilitating workshops about joy, purpose, and fulfillment. And so today, I'll provide a brief overview of why creating joy and optimism matters. I'll share some principles related to them and offer a few ways in which we can all create more joy and optimism. And as a person affected by Parkinson's, you might be thinking, oh, isn't it a bit frivolous to focus on joy and optimism, especially right now, amid everything going on? And I can appreciate the seriousness of this thought and say that now, more than ever, we need to find power in ordinary things that can help create extraordinary experiences. And at a surface level, we recognize this need, but joy and optimism matter in some pretty tangible ways too. For instance, joy produces emotions that are contagious, and we spread them through our tone of voice, our facial expressions, our gestures, even our walk. And one of the effects of this is that if we know we're going to be able to catch someone else's emotions on this unconscious level, then we're going to be able to be attracted to people who are expressing that feeling of joy. Joy also makes us more emotionally resilient, and it prevents burnout. Often when we're going through a hard time, we might postpone joy. We'll say, I can't take a vacation right now. I'm so busy. I've got this big presentation. Or I can't go to that dinner party. I have to work tonight so I can hit that big milestone. And a lot of us do this when we're working through something difficult or stressful. We'll postpone joy. But if we bring little moments of joy into our stressful times, it actually helps ensure our emotional resilience. And it helps our body's cardiovascular responses to stress, which can help prevent chronic stress and avoid burnout, which so many of us are experiencing. And joy also opens us up to new ideas. And one of the theories behind the development of positive emotion is to broaden and build. The idea that negative emotions help to narrow our focus so that we can actually deal with the immediate threats and challenges, that's a great idea, and it's important. And so, for example, think back to the early days of the pandemic when we were living in close quarters. We were worried about a constantly new variant that we had to adapt to, new rules, new restrictions. And all of these things caused us to spike the negative emotion that narrows our focus, and it actually helps us deal with a problem. But this also makes it almost impossible to think about the future, to plan and create and grow. And that's what positive emotions evolved for, to broaden our view so we can build resources for the future. And one measure of creativity is called cognitive flexibility. And when we're in a state of joy, that flexibility increases, which means you can make better decisions because you'll consider a broader range of scenarios before arriving at a decision. So joy makes us more creative, and it helps us make better decisions. And finally, joy strengthens our relationships. When we're in a state of joy, when we share joy, or even when we see something joyful, it helps deepen our sense of trust, our connection, and our intimacy. So which of these benefits, as you see this list, which of these benefits of joy is most important to you right now? Go ahead and type your answer in the chat function so we can see what's resonating for you. Okay, so let's now double click into the benefits of optimism. And to narrow our focus, I'll strictly discuss what's called learned optimism, which is a positive psychology concept that I'll explain in a little bit. But learned optimism improves our physical health, and it's a significant predictor of health outcomes related to food, movement, sleep, and things that you've explored already today. Optimistic people have lower stress levels. So the ability to face challenges with a positive attitude means that optimists experience less stress, but they're also more resilient to handle the stressors and may even thrive in stressful situations. And when faced with a challenge, an optimist is going to take a problem-solving approach and use those stress management techniques to keep those emotions in check. And the end result of this is feeling like we have a greater sense of control over the outcome, which of course reduces stress levels. Learned optimism also helps you live longer. And this stands to reason because, as I mentioned, you take a more proactive approach to your health that helps reduce that chronic stress, which can be such a risk factor for so many diseases that shorten life expectancy. Learned optimism also improves your mental health. And think of it like mental fitness, where you're able to look at situations with a more generous and balanced point of view, which can help relieve symptoms of mental illness, such as anxiety and depression. Learned optimism also increases your motivational levels. It can help sustain motivation because when you believe that you can achieve your goals, you're more likely to continue to pursue them. And optimists have a growth mindset that tend to view challenges simply as opportunities to learn and improve. And so when you look at this list, I see that a couple of you responded to the joy benefits that were most relevant to you or interesting to you. I want to know now, type in the chat function, which of these benefits of optimism most intrigues you right now? Go ahead and type that in the chat function. Love to know, are you most intrigued by physical health, by reducing your stress levels, extending your lifespan, improving mental health? or increasing motivation. Yeah, someone said reduce stress, increase motivation. Kind of a mix we're seeing. Wonderful. This makes it relevant for so many of us, right? So while little moments of joy might seem trivial and optimism might seem elusive, you can see how they can help address our mood and improve our overall well-being. But what exactly do we mean when we say joy and optimism? Well, joy is an intense moment of experience of positive emotion. Think of it like laughing and smiling and that feeling when you're so excited you want to jump up and down. Joy is simple. It's immediate. It's about how good we feel in the moment. And that's maybe one of the things that makes joy seem less important sometimes, because these moments are so small and fleeting, and yet they can have surprisingly big effects. Many that I just covered, right? Now, optimism can be understood as reacting to problems with a sense of confidence and high personal ability. And it also includes positively anticipating something in the future. That could be a few moments from now, a few days, weeks, even years. The more optimistic we are, the more positive moods we experience. With more positive moods, there aren't just mental and emotional benefits, there are also physical benefits, including a reduction in pain and even reduced susceptibility to the common cold. When our minds are more open to seeing positivity in the world around us through joy and optimism, then we're creating what psychologists and coaches like myself call upward spirals. So let's walk through the components of joy and optimism. Now, I think the last couple of years have really laid bare the dearth of joy practices here in the US. And so the research is really instructive for what we can do in our daily lives to cultivate more joy. Joy is basically made up of 8 virtues: connection, flow, awe, play, courage, kindness, inspiration, and gratitude. I want to know, and you can type in the chat function, which of these virtues is most accessible to you right now? I realize not all of these are immediately accessible to us, but let's take a moment. Let's take some inventory. Michelle says kindness. Yeah, that is one that's always available to us that we can take action on. Another one, Shelley says kindness. Great. The opportunity here is to take inventory of what is available to you. Play, how fun. Okay, so these are the 8 virtues of joy. So think of how you can apply these in your life. And by the way, they're in the handout that you'll get accompanying this particular workshop that kind of walks through different ways to support yourself in creating more joy and optimism. They've just put the handout link in the chat. So go ahead and click on that so you can take notes as you follow along. Now, another way to create joy is through the physical world around us. And there's a wonderful book, it's called Joyful, written by designer Ingrid Fettel-Lee, that talks about the aesthetics of joy. And she has a website by the same name, incidentally, and a wonderful TED Talk that I encourage you to check out. But Lee identified 10 aesthetics of joy to create a connection between that feeling of joy that we have inside us and then the tangible qualities of the world around us. Things like energy and abundance and freedom. And you can see this whole list here, right? Well, each one is basically an asset that we can use in our homes, in our workplaces, and in communities in ways that create joy. So think about this. Visualize rainbows, or maybe even rainbow sprinkles. Visualize tree houses, swimming pools. There's something about all of these things that really cuts across an aspect of identity, no matter your age, your gender, your ethnicity, or any other aspect of identity. They're not joyful for just a select few. They're universally joyful. So check out this mask. This is the mask I bought in the early COVID days. And I bought it because I knew it was going to bring a smile to other people's faces, as well as my own, at a time when there wasn't necessarily all that much to smile about. But what is it about this mask or any of these things that makes them so joyful to us? I mean, sure, the feeling of joy can seem mysterious and elusive, but we can access it through tangible physical attributes. Things like pops of bright color, like my red lips, round shapes, symmetrical shapes, repeating patterns, a sense of abundance, and a feeling of lightness or elevation. So why do bubbles or Ferris wheels or hula hoops make us smile? Well, our attraction to circles is backed by research showing that humans implicitly associate curved forms with safety and positivity and ease, and angular shapes with danger and negativity. And of course, there are more of them. What you see on the screen: freedom, surprise, celebration. And if these are the things that bring us joy, then why are they missing from so many places in our world? Why do we work in beige cubes? Why do we send our kids to schools that look like the color of cement? Might our cities look better with a different approach to color? And of course, this is most acute in nursing homes and hospitals and homeless shelters and housing projects. How do we end up with a world that looks so drab so much of the time? We all start out joyful, but as we get older, being colorful or exuberant, it opens us up to judgment. And adults who exhibit genuine joy are often dismissed as unserious or superficial or childish or self-indulgent. And so we start to hold ourselves back from joy, which actually comes from a deep cultural bias. A couple hundred years ago, leading color theory scholars said that people who love color and who want to express their love of color and their joy through color, so-called savage nations, their words, uneducated people, children, these people are primitive, they're unsophisticated and juvenile, whereas more refined people avoid vivid colors. So that was the prevailing theory a couple hundred years ago. And scholars at the beginning of the modernist movement said freedom from ornament is a sign of spiritual strength, and that to engage in the decorative embellishment of craft traditions practiced by many indigenous cultures, often women, is a moral weakness. More recently, we can look at the popularity of Chip and Joanna Gaines' home designs and countless others that are basically a recipe for all neutral tones all the time that are supposed to connote some sort of sophistication. So it's no surprise then that we've really pushed joy to the margins in our lives. And so for me, this seems like a perfect time to reclaim joy and patterns right now. And so I want to know, we've got a poll, actually. You don't have to type it in the chat function. We'll issue a poll. Which aesthetic are you most drawn to? So just click the answer and we'll get to see what you came up with. Now, I can't see the results of the poll, but maybe Danielle or Erin could provide the answer in the chat function. I'd love to see what people come up with. And once we do, we're going to continue on and shift to optimism. So Danielle or Erin, can you populate that poll? Wonderful. Aha, energy and harmony. So salient right now, huh? So is play. Thank you, everyone. We're going to shift to optimism. And there's this common misconception that optimists are sort of ignorant about reality, that they wear rose-colored glasses and they're probably skipping around a field somewhere, having a perfect day, because of course they are, except they're not. Optimism comes from a simple shift in mindset that can have life-altering effects. And it's mostly a learned quality. In fact, a study that looked at 500 sets of twins showed that just 25% of our optimism is inherited. Now, many things in life are outside our control, but one thing that is within our control is how we explain the things that happen in our lives. And this is known as our explanatory style. The language we use and the way we perceive our experiences, especially challenging ones, can have a lasting effect on who we become. And the work in learned optimism comes from a book with the same name, authored by Dr. Martin Seligman, the father of positive psychology. And he offers 3 explanatory styles that we typically use when we recall experiences: permanent, pervasive, and personal. So for each style, we can choose either an optimistic or a pessimistic response. And to understand these better, I'll just use a recent example from my life, but I invite you to kind of make note of what might be true in your life as I walk through these examples. So just the other day, I noticed the orchid on my piano is nearly dead. And here are the different explanatory styles that my self-talk could adopt. First, do I view this as permanent or impermanent? Well, if I view it as permanent, it might sound something like, oh, I'm never going to have a blooming orchid plant. If I view it as impermanent, it might sound like, you know, my plant care regimen isn't working right now, but there's always next season. The next question about pervasiveness. Do I view this as pervasive or specific? So an example of pervasive might sound like, my orchid plant is like everything else in my life. All effort, but no bloom. Or I could choose the specific approach. You know, I may have lost that plant, but I still have my garden of herbs. And finally, we're talking about personalization. The prevailing question is, do I view this as personal or external? So if I view it as personal, it might sound like, I just don't have a green thumb. If I view it as external, it might sound like, you know, maybe there wasn't enough sun, or the orchid needed more water while I was away. Or perhaps the temperature of my apartment is just like sucking the life out of my plant. So you can see how these 3 Ps, permanence, pervasiveness, and personalization, are the cognitive processes that really underpin the way we understand our experiences in the world. And we can use them to create more helpful thoughts, which lead to greater optimism. And this isn't to say that all situations should be met with a sort of unchecked optimism. Critical thinking is going to help us minimize future risks. It's going to put things in perspective and generally learn, grow, and flourish. So it's a matter of knowing our explanatory styles and then understanding how they shape our experience in the world and the ways in which they can lead us astray. So now the question then is, okay, how can we apply these insights about joy and optimism to our lives? And it might seem incredibly obvious that you'd be, you know, feeling better being outside on a sunny day rather than, let's say, under the dull fluorescent lights of a typical commercial building. But the effects of these small differences can be profoundly surprising. And so I'll share just a few examples from the research. A study of acute care nurses on a hospital ward found that they laughed more spontaneously when they were in a ward that had a little bit more natural light. And a study done at a Coca-Cola facility in Europe tested 2 different floors of workers. And on one floor, the researchers recruited a small group of coworkers to surprise their colleagues with small, joyful gestures. The other floor was basically the control floor. They didn't do anything. So on this floor where they had this intervention, little things like a cup of coffee just because, a cupcake when they're having a bad day, maybe a note of encouragement. Those were all types of gestures that these colleagues engaged in. And at the end of the study, there were 10 times more of these joyful gestures compared to that other floor. So people weren't just paying it back to the people who'd given them nice things, they were actually paying it forward. And research conducted in countries as diverse as Sweden, Argentina, and Saudi Arabia show that people working in more colorful environments are more alert, more confident, friendly, and joyful than compared to people working in drab spaces. And in this way, color applied to the surface of something isn't just about the surface. Color makes us feel more alive and energetic, and yes, joyful. And these feelings then have ripple effects, influencing our mindsets and our interactions with others. And this really squares with the work of a nonprofit called Public Color that goes into neglected, underserved New York City school districts and transforms them with vibrant paint. And I love hearing the results because get this, one of the things that they've learned from the school administrators is that as graffiti disappears, attendance improves, and the kids say that they feel safer inside these painted buildings. And the same is true of our love of abundance. We evolved in a world where scarcity was dangerous to us and abundance meant survival. And that's why one confetto, which is the singular of confetti, isn't very joyful. It's something you might pick off your shoe. But when you multiply it, you have a handful of one of the most joyful substances on earth. The French architect Emmanuelle Moreau uses this idea in her work. And this is a nursing home, you can see, where she designed when in this room, residents visit with their families, and the families actually linger a little longer. And so, sure, it looks like decoration, but it actually influences the behavior of people in it and the well-being of its residents. So rather than putting more caffeine into our bodies, we can use the environment to influence our energy levels so that we can create more joy. And these things don't have to be expensive. It might be as small as the color of your mug or your couch cushion. So now that you know what to look for, you can begin to spot little moments of joy or curate little moments of joy that are otherwise hidden in plain sight. And it's called joy spotting. And it's actually a mindfulness practice where you're tuning into your senses to be able to notice more joy all around you. And I've got prompts in the handout, at the end of the handout, that can help you with this. So let's talk about cultivating optimism. When it comes to cultivating optimism, there is great evidence-based practice, cognitive practices that you can do. And I know that other speakers have talked about the importance of these practices. And I'll share just one with you today, which is called the ABCD practice. And you can see the different components, naming the adversity, really checking into the belief that you're telling yourself in terms of how you're interpreting the event. And tuning into the consequence when you have a given belief, learning to dispute it, and then noticing what happens energetically at the end. And the handout is actually going to walk you through this entire process. But the short of it is that you want to actively bring up and dispute your negative beliefs so that you can prove them wrong. And when you do this, the research shows that this leads to feeling more energized, more motivated, and more optimistic. Now, beyond actively challenging your thinking to create more helpful thoughts on the daily, we've got a list here of 7 other ways you can cultivate optimism. So if you find yourself obsessing about a problem, maybe feeling negative or experiencing self-doubt, you want to change your focus toward a solution by asking, what's one thing I could do differently that might make the situation better? You can also create an imaginary movie reel of your ideal life, including specific details about how you look, how you feel, where you live, what you're doing, what you've accomplished, what your life is like. And when you set aside 30 seconds every day just to play this movie in your mind, powerful things happen. So set an alarm on your phone to remind you, because this simple mental training exercise is going to instantly boost your mood and transform how you think about yourself in your life. You also want to get into the habit of looking for any improvement in your current situation as a solution, no matter how small. And consider creating some meaningful constraints that are going to help you minimize temptations that might send you away down a path you don't want to go down. And the reason why you want to minimize these temptations and create those constraints is so that you can succeed more often than not. And when you do this, you boost your optimism. Consider conjuring up your inner coach by thinking of a role model and asking yourself, well, what would so-and-so do if they were in my position? Consider taking a few moments every day to ask the question, what have I done well today? This is a simple but powerful gesture that reinforces optimism. And then, of course, as others have spoken about earlier today, optimism is easier when you feel good. Sleep, rest, food, movement are all the foundations for positive energy and a good mood. Okay, so now that we have lots of ways to practice joy and optimism, I want to know, and we've got, I invite you to just simply type in the chat function, what's one way you're going to practice joy today or this weekend? Go ahead and type it in the chat function, because wisdom is shared, not learned. We want to learn from each other. What are you going to say yes to this weekend in terms of practicing joy? Aha! Picking corn for the garden. Yes, I have a delicious cucumber that I'm waiting to eat when our time together is done today. Visiting a friend. Martini. Yeah, gratitude practice. It is a lovely day to get outside. Thank you. And sort of similar to thinking about a joy practice you can take action on today or this weekend, we want to know, what's one way you'll cultivate optimism today? And we've got a poll for you. We'd love to see, how are you going to cultivate optimism today? We talked about that ABCD exercise. You can find it in the handout. I just walked through those 7 different steps. Go ahead and take a vote, and we'll see what your results show. And while you're completing that, I want to share a story. So I recently learned this really great tradition that the Navajo do. And it's very unique. So the Navajo celebrates something very unique. It's a baby's first laugh. And this usually happens around 3 months of age. And the person that made the baby laugh for the first time gets to co-host a party with the baby and hand out gifts. It's an all-around celebratory occasion. And why this is so important is because they believe that this is the moment when a baby spirit decides to commit to their human existence. Before this, they're trying things out. They're not sure of a lot in this world. But when they laugh, that's the moment that they become fully human and fully committed to all the ups and downs of life. And I suspect a lot of us tend to think that joy and optimism are nice to have. But what this custom illustrates is that joy and optimism are integral parts of our humanity, that moments of laughter and delight are central to what makes us human. And when we push joy or optimism into the margins, when we say there's some sort of reward, or it's something we get only if we deserve it or we're lucky, then we're putting an important part of our humanity on hold, rather than acknowledging that joy and optimism are essential to our thriving. And when so many horrible things are happening in the world, or when the demands of a medical diagnosis seem to be too much, it's important to remember that the drive toward joy and optimism is the drive toward life. So I love seeing this pretty good distribution of the different ways you're going to cultivate optimism today. Thank you for sharing that. You know, it's important to remember joy and optimism aren't something that we have to find. We can create and cultivate them. We can do this for ourselves and for others. And if you enjoyed today's presentation, share it with a loved one. Invite them into a joy or optimism practice with you. Collaborate on applying these insights and practices to enhance your personal health, your relationships, your home life, and more. And check out that handout that's really going to help you incorporate these insights and practices into your daily life. Thank you so much for the opportunity to connect with you all today.
Bless you. Thank you, Megan. That was outstanding. Anybody who liked this talk, figure out on the thing here how to raise your hand. I don't think we can clap, but we can at least raise our hands. So thank you so much. We have just a couple minutes for questions. If anyone has a really quick question. I guess one question is how as a physician can I incorporate this into what I do all day when I'm seeing one patient after another?
Yeah, I think maybe the most powerful way is co-creating these moments with your patients. So when you're first meeting with the patient, and maybe you already do this, but making that time with them, because what's going to benefit you is going to benefit them as well. And we tend to overestimate how much time we need to create these moments. I mean, truly, it's as little as 2 minutes.
Yeah. one of the things I often do when a patient says, you know, I fell last week and I fell the week before that, what I almost always say is, so what would you do different the next time to keep
Yeah.
that fall from happening? I can't change what already occurred, but let's learn from it, and what can we do to make things a little bit better the next time? And you also use the same term I used, you know, about setting up for success. If you're having cognitive problems, you know, what's your best time of day? If you're going to exercise, don't exercise when your Parkinson medicine is off. Exercise at your best time of day. And if you're having trouble, you know, sometimes patients have a long list of all the things they used to do that they can't do anymore. And I say, well, yeah, okay, there's that long list of those things. Let's start making a list of the things that you can do.
Yeah.
So,
Yeah, sometimes we just need the help of someone else to get us out of our thinking patterns into new ways of interpreting and explaining our world.
so one question is how to get through the long winter in Minnesota, and then we'll let you go after you solve that problem.
You know, I'll tell you, about 15 years ago, I took up snowboarding to make winter a little bit more fun. But I'm not advocating people take up snowboarding, but how might we embrace, you know, create your own sort of indoor enthusiasts club with people? Like, there are a lot of rituals that we can tap into, rooted largely in social connectedness. Also realizing this might be one of the biggest things. We're in a society where we're sort of like, let's go, go, go. Let's optimize every moment of our life. And that's a season of life where maybe we're invited to slow down and to work with the natural rhythms of the season. It is a time of rest, to look inward and reflect. And so what are some of the wisdom traditions that we can learn from? I'm a big fan of Ayurveda, and what it can teach us about seasons of life and how our body tends to operate. You know, in the summer, we want to be energetic. We want to be out and about. And it's okay in the winter to look inward, to go inward. But really using some of the aesthetics principles that I shared today to make sure the space, when you're inside for so long, that space is conducive to moments of joy.
Perfect. I think this segues perfectly into Mike Justek's video. As I said, Mike is the most optimistic person I've ever met. And so he took the opportunity to make a video from other people with Parkinson's to share their approaches to optimism. So we'll show that video now.
Optimism. Define, it's a tendency to look on the favorable side of things. We're going to look at a group of people who are self-proclaimed optimists and get their thoughts on just what optimism is, how you get optimism, and how you avoid the opposite, depression. This group, in fact, chooses optimism on a daily basis.
Well, that's a good question. I would think so. I think you would tend to see somebody who's an optimist. They tend to have a smile on their face. They tend to, their eyes just seem to glow a little bit. They tend to look up rather than look down.
Yeah.
I think you can tell by the way someone the mannerisms or their posture when they walk down the street.
Well, they smiled. And maybe that's who the optimist is the first person who smiles first at a situation, or the person who laughs first.
Yeah.
At something that's really devastating, but can say, you know, this is devastating, but isn't this ridiculous timing at what happened, or isn't this ridiculous how it happened?
More than likely.
How?
Just because they got their shoulders upright and they're smiling, and you know, they just seem to be enjoying themselves or are happy.
Okay.
You know, for the most part.
And
when I wake up each morning, I think in terms of what I can do and what is possible instead of in terms of what is not possible. I don't think of things in terms of I can't.
Living well.
yeah.
I want people to see that you can live with this disease and that you can still continue to have a fulfilling life and still belong and contribute to the society that you live in. And
A couple of things. For one thing is my family. I have a dad who was always an optimist. We lost him this year.
Right.
And that, but he always, every morning, woke up with a smile on our face. Always said to look for the good in people.
Yeah.
You know, he was just such a great role model that way. It was really awesome to be his daughter, and I guess that's the way I was brought up. So, and my faith. I have to say that I didn't always have that, but I've learned to have faith, and things always seem to work out in the end.
I used to write little notes where I'd be, and I'd say things like sus, and I knew in my mind that stood for sit up straight and smile.
Like you said, you have to look for optimism.
Okay.
You know, in this world, there's so much that you could choose to look at instead, but choosing, it has to be a choice.
When you pass somebody that feels maybe something similar to you do, it just makes you just want to pass it on to somebody else.
Do you try to pay that forward?
Well, that reminds me, a long time ago I read a book, and it was about something about taking the high road or something like that. And it said, you are most like 5 people that you hang around the most.
Huh.
And that really hit home to me.
That's for sure. All right. And that, I guess, one thing that keeps me optimistic is knowing that if I can help somebody else make a better day for somebody else, that just makes me feel that much better too.
Yeah.
So
Great.
That Mikey says it doesn't really matter what you do in life, but whatever you do, just be significant.
Okay.
So what does that mean? It can mean really whatever you want, but do something. Do something with your life. Make something of yourself, and it really doesn't matter what it is, as long as you feel it's significant. I think that's important.
When they said Parkinson's, I was like, Parkinson's? Why would it be Parkinson's? I'm so young.
44 years old at the time and an elementary school teacher, Liz cried herself to sleep that night.
Thinking, brooding, grieving, wondering.
But bound by a terrible diagnosis,
All right, here we go.
Liz again
Come on, bud.
found her freedom.
Here we go. I can get off the bike and my symptoms show. While I'm on the bike, I'm just a regular gal.
Good for her.
Morning.
Good for everyone.
Good morning. Good morning. Good morning.
Got it.
Pedal, roll, and stroll for Parkinson's. Hey, it's time to bike.
Having entered the community of Parkinson's patients,
Have a great time on that bike.
Liz was
Now,
not
remember that you
about
can tip
to
anything
keep biking to herself. Which is why Alexander Barshovsky
Then we can get your leg over.
is getting on a bike
You gotta mess up your hair.
for the first time in years.
Here we go.
Okay, you got the brake.
My dad has been asking to get on a bike for a couple of years because we've read that people with Parkinson's can do that when they can't do other things. So
Hi, Kate.
it's amazing he's pedaling. Wow.
How's it feel?
Good.
And he didn't think he could do it.
A few minutes later, we spotted Alexander on his own.
He's very happy.
I wanted to pay forward what my family and friends had done for me by encouraging me to live my life well in spite of the Parkinson's.
This year's pedal, roll, and stroll is Liz's third.
I have lost half my garage space.
But year-round, she's turned her garage in Edina and Williston Fitness Center in Minnetonka
It's a Delta trike.
into lending libraries
You got a seatbelt on.
of specialized bikes.
And they smile and they ditch their walker and they ditch their wheelchair.
Just like that.
Hey, he's doing most of the pedaling. And they say, look what I'm trying today. You gonna stop us for speeding? Thank you, my big supporter. She's a teacher, so for her to be sort of bringing this to other people just fits her to a T. Thank you for being here.
Liz Ogren can't stop anyone from getting Parkinson's. So instead, she's helping them.
You got it?
Go.
I'm teaching people that they have a choice about how they live their life.
Boyd Hooper, KARE 11 News,
Come on, get on a bike!
Bloomington. Anyone keeping track would tell you.
I was diagnosed at the Mayo Clinic.
Mike Justic has seen his share of dark days.
It started with when I brushed my teeth, basically, my hand would stop.
47 years old and the father of 4 school-aged children when Mike was diagnosed with Parkinson's disease.
The enormity of it didn't hit me because nobody in my family's had Parkinson's.
Dark
There we go.
days that gave way to light nights.
It gives me an outlet.
Each year, 58,000 Americans learn they too have Mike's disease.
I shine one light for each and every newly diagnosed person with Parkinson's.
It's just that most of the others aren't funneling their remaining energy into this.
This is a visualization of my neighborhood.
Parkinson's patients are known for sleepless nights.
And this was Deck the Halls.
And 11 months before Christmas at 3 a.m.
The colors in here.
Mike can be found here.
It just keeps going.
Programming next year's show.
Start with these.
Parkinson's medication
4 of these
can sometimes cause obsessive behavior.
And I take 5 of these.
Care to guess what Mike is doing with his?
Oh, I kind of think I've channeled my compulsion into something good.
As projected on his garage door.
Thank you for your support.
Mike now has a foundation.
Merry Christmas.
The money he's raising helps pay for an exercise program for Parkinson's patients and 2 Christmas light bus tours.
They're going to get sparkling cider.
Among the gifts that earned Mike a 2014 Community Service Award from the Struthers Parkinson Center.
He always has to have something to do.
Robbed of health, career, and independence, one could easily go to a dark place. It's just not the way Mike Justick is wired. Boyd Hooper, Carol 11 News, Plymouth.
Pretty amazing, huh? I apologize to those of you who are not able to hear the sound. I hope you could at least see the video and see some of the amazing things that people with Parkinson's are doing. I had no trouble with the audio or the video. This year, Mike is doing a Halloween light show rather than a Christmas show. So you can go to his Mike Justick Foundation for Parkinson's Disease and see what he's up to. Boy, I hope you leave today with optimism. Thank you to all the speakers. Thank you to you for joining us. There will be a evaluation when you click out of your attendance. There will be a thing where you evaluate the program. Please give us an evaluation. The only way to make things better is to hear what you thought was good, to hear what you thought wasn't so good or what was missing. You will get a link to today's presentation, and you can also so you can review this anytime you would like. I want to thank our sponsors one more time, Amneal and Kiowa Kirwan. I want to thank the Parkinson Foundation for helping with all the technical aspects of today's program, which I think went amazingly well. You can contact the Parkinson organization through their 1-800 line anytime if you have questions, problems, don't know where to go, who to call. They also have a wonderful website at parkinson.org. I'd also like to invite you to participate in programs at Struthers. You do not have to be a patient at Struthers to participate in support groups that we support or other classes or programs. But we would love you to be a patient here at Struthers if you would like. So we also have clinical research studies going on. So please contact us anytime with questions or concerns. You can also be on our SPC email list by contacting us at spc@parknicolet.com. Then we will add you to our email mailing list, and you'll hear what we're up to. We are, ever since COVID, we've been sending out weekly emails saying, good morning from Struthers, here's what's going on this week. And it's just kind of a nice way to start out the week. And again, you don't have to be a patient at Struthers to be on our email mailing list. So with all this, I think we're ending 1 minute ahead of schedule. So bless you all. Thank you for coming. Hope you enjoyed the morning. I do not wish people with Parkinson's a great fall, but I do wish you a wonderful autumn, and we'll see you in the new year in 2023. So thank you to all.